Good afternoon. My name is Cherie Hall. Today I will be presenting racial and ethnic disparities in teenage pregnancy. In the United States, African American women and other racial minorities experience significant racial disparities in healthcare delivery. Surveys have indicated that teenagers from racial and ethnic minorities in the country are more affected than whites. Racial and ethnic pregnancy is a developmental issue that determines the vulnerabilities of the affected individuals in society. Racial and ethnic minorities face numerous barriers to obtaining quality and timely care and are often barred by their financial backgrounds. Research has shown that Blacks and other racial minorities, teenagers and mothers generally have a higher mortality rates linked to pregnancy and childbirth. The first developmental theory employed is the theory of reasoned action. This theory explores the connection between individual behaviors and attitudes. The other developmental theory I used or seen was racial conflict theory, which examines the tension and disparity between individuals of diverse ethnic groups. This theory fosters a better understanding of the connection between racial prejudice and the instances of pregnancy in the current American society. Trends of health inequalities in teenage pregnancy. Several studies on racial and ethnic disparities in teenage pregnancy has been conducted to enlighten society about the same. Information is lacking on how tension and race disparities between individuals of different races encourages teen pregnancies in minority races. According to Charlton and colleagues, the problem is perennial and is worsened in the past decades. The author imitates that Latino teens record the highest number of teenage births, as it is 42 for every 1,000 teenage girls of the same race. African Americans recorded 31 births for every 1,000 teenage births. And for Asian Islanders, teens, there were 9 births for every 1,000 girls. On the contrary, African Americans and people of color dominate the rural areas with high society problem rates. The disparity is often associated with education and access to contraceptives because white teenagers have better access to education. Hence, they are more enlightened about birth control measures than people of color. Social drivers of health inequalities. Several studies have investigated the main social drivers of health inequalities and their correlation to racial and ethnic disparities. According to Thatcher and colleagues, various social detriments of health in different communities contribute to the high teen pregnancy rates. The author suggests that one of the dominant social detriments is the few opportunities for positive involvement in the teens community. This is evident in the people of color who lack opportunities to engage in gainful economic activities, forcing them to engage in social ills and exposing them to high pregnancy rates. Charlton and colleagues added that neighborhood segregation is another major social detriment that increases the probability of teens from races of color being pregnant while still teenagers. Nadi and colleagues hint that neighborhoods with minority races and ethnics are more prone to neighborhood physical disorder than majority races. The low income level is a premonition for social ills, thereby increasing teenage chances of premarital sex compared to their counterparts from high income neighborhoods. High death rates among Black and minority female teenagers. Teenage girls of minority ethnic groups such as African Americans and Hispanics record high mortality rates compared to the majority ethnic groups. According to Sangan and colleagues, at least 600 teenage girls died in the United States of America every year due to pregnancy or related complications. The author imitates that pregnancy-related deaths among such teenagers occur 1/3 of the time during pregnancy, more than half during pregnancy, and 14% between 6 weeks and 1 year. Such information underscores the benefits of access to health care, especially for teenage girls of minority ethnic groups. Thatcher and colleagues also added that Black teenage girls and other minority ethnic races record higher pregnancy-related deaths than their counterparts of majority races. Natty and colleagues assert that several cases of pregnant teenagers-related deaths, especially those involving African Americans, can be prevented. One of the main conditions which cause the death of pregnant teenagers is cardiovascular disorder, underpinning the need to improve care for such conditions for a better pregnancy-related outcomes. Also, Black pregnant teenagers record high blood pressure and hemorrhage cases compared to white teenagers. In most cases, the preventable conditions are easily and readily treated among whites, but people of color can hardly access appropriate treatment options. Birth risk and outcomes. Black pregnant teenagers and those of the ethnic minority groups have pertinent risk factors which leads to high infant mortality. Such factors pose long-term consequences for the cognitive and physical health of children. An expert evaluation of the issue reveals that low birth weight and preterm births are among the leading causes of infant mortality, especially in minority ethnic groups. The provision of poor medical care for Black pregnant teenagers reveals why the record high rates of preterm births and low birth weight births compared to their white counterparts. According to Wong and his colleagues, the disparaging findings hint that at the lack of pregnancy-related medical care, especially for Black teenage girls. On the contrary, there are low rates of such complications among teenage girls from the majority ethnic groups. Additionally, Nadi and colleagues disclosed that pregnant teenagers from the majority of groups receive early and regular prenatal care, which enables them to manage their underlying medical conditions, share their health information, and monitor their health conditions. Increased barriers to care for minority ethnic groups. Study reveals that medical coverage before, during, and after pregnancy leads to better access to medical care, thereby ensuring healthy pregnancies, better infant outcomes after pregnancy, and positive maternal outcomes. A general analysis of the American population reveals that Black African Americans and other people of color are often uninsured and confront numerous barriers to medical care. Medicaid has stepped up its efforts to fill the gap and improve the quality of medical care among Black pregnant teenagers. Kainger revealed that despite the organizational efforts, teenagers from minority groups are still at a higher risk of lacking insurance before pregnancy. Therefore, they often lose their medical coverage once the 60-day Medicaid postpartum coverage ends. Thatcher adds that while pregnant teenagers from minority groups confront challenges in accessing insurance facilities, and those from the majority group readily assess them, ensuring that they get the proper medical care while pregnant. In addition to the lack of health coverage, African Americans and other people of color confront myriad barriers to medical care, such as a lack of access to logistically and culturally appropriate health care, and limited access to hospitals and healthcare providers. The role of historic and ongoing racism and prejudice. Studies reveal historically and ongoing racial discrimination discrimination racial disparities in teenage maternal and infant health. According to Thatcher and colleagues, the effects of social detriments such as racism, chronic stress on infant and maternity health outcomes, and other social detriments increase the rates of depression among pregnant African Americans. In most cases, Black teenagers are discriminated against during pregnancy and while giving birth. Such evidence has led to a close evaluation of maternal deaths and near misses of Black women and others from minority ethnic groups. A study on hospital births in Florida revealed that efforts are made to improve mortality for Black newborns, especially those of teenage mothers. According to Saigon, a reduction in rates of low birth weight and preterm births and the reduction of racial disparities in such measures are a central focus of local and national incentives championed by policymakers and clinicians alike. According to an expert evaluation, it revealed that low birth weight and preterm birth are among the main causes of infant mortality, especially in minority ethnic groups. Method. Researchers must adopt the best method that will enable them to describe the process of the data collection method. For instance, information on whether the data was quantitative or qualitative is provided in this section. Besides the justification of the data collection, method forms a significant part of the research method section. The quality of data collected or used plays a significant role in this research method. It is described in terms of variables and manipulations done on the data treatment. Oftentimes, the ethical consideration involved in the research also forms a key part of the method section. Without this information, the reliability and efficiency of the results attained becomes questionable. Thus, the need for information on the research designs, reliability, and validity. As part of addressing the racial and ethnic disparities in teenage pregnancy, this paper provides the method adopted from the study design to the data collection until the final stage of analysis. It will also examine the ethical concerns that will be considered in developing a research strategy for this project. Participants. Having an in-depth understanding of racial and ethnic disparities in teenage pregnancies between people necessitates the use of a more immersive study design. Research examines the qualitative and qualitative aspects of topic issues similar to the one being undertaken underpins the use of descriptive study. The descriptive study design will involve three main processes: a survey, observation, and a case study. The survey will collect vast data and information from the heterogeneous sample population across Minnesota. As part of ensuring that the research was within a statistical threshold, and a total of 50 participants were involved in this research. The number estimation was based on the ideal that a good statistic sample population has to be above 30. Participants to be engaged in the study are victims of racial and ethnic disparities in their communities, whose conditions have forced them into teenage pregnancies. They will give firsthand information on how disparities in healthcare provisions impacted them negatively and positively as pregnant teenage moms. Materials. The study will require different research materials to accomplish the set goals and objectives effectively. For the survey research, the primary tool required will be a questionnaire. A questionnaire is a critical tool in conducting surveys because it is where participants give their responses. Also, the questionnaire is designed to suit the needs of the participants and reflect their characteristics. Recording equipment will include sample tools like pens, paper, and more advanced ones like laptops, personal computers, and tablets. Different items pertinent to target participants will be measured to have an in-depth understanding of the respondents. The health-related factors related to medical conditions, financial statuses, physical attributes reveal the impacts of health disparities between people of color and whites. Procedures. As part of ensuring that the research was valid, all steps were conducted in a statistically valid manner. The first step comprised the recruitment strategy. This was based on the criteria that the respondent was within the area around Minnesota and must have been directly affected by the research subject. Each participant was instructed on the procedures to ensure a standard performance approach and the social inclusivity approach. The third step comprised determining closed-ended survey questions to be answered by the participants. The questions include education and job training perspectives, which sought a profound assessment of racial and ethnic teenage pregnancies. The design of questions will also follow the standard format, and closed-ended questions are preferred because they achieve clear goals and facilitate the data analysis process. All questions will be then cross-checked to ascertain that they are ordered properly and achieve the set goals and objectives. The survey should be distributed in person to cultivate customer confidence, boost interpersonal communication with the respondents, and make them feel during the survey. After answering the questions, the survey materials will be collected, cleaned, and ready for data analysis. A debrief session with the participants will be held to enlighten them in the next research process and inform them about the survey process. Plan analysis. Various types of data are expected from the study and would have a significant impact on the examination of racial and ethnic disparities in teenage pregnancy in the United States of America. One critical data is the number of pregnant teenagers or the percentage of pregnant teenagers in the country. Also, data on geographical distribution would unearth the dominant race that are more affected by teenage pregnancy and the regions they occupy. Additionally, data and information on racial and ethnic disparities will be critical in examining the reasons behind the increasing racial and ethnic disparities in the country and suggest viable and practical solutions to improve healthcare qualities and address the challenge. Finally, data on the impact of racial and ethnic disparities are expected from the study. In data analysis, the first step will be to determine the research objective and hypothesis to reveal how it will be tested. This stage necessitates asking questions and determining the main issue under investigation and which needs to be resolved. Next, it will be data analysis, where data will be interpreted, a stage that highly depends on the research aims. Data interpretations will be done through the right type of data analysis and would depend on the types of data available in research aims. Finally, the data analysis process would end with sharing results with the relevant parties. Upon data interpretation, the insights will be shared with the relevant personnel. Due to the type of data expected from the research process, the two visuals to be presented, the data will be bar graphs. The graphical framework presents descriptive statistics and details the fundamentals of racial and ethnic teenage pregnancies. Thank you so much for tuning in today with me. Have a good day.